February is Heart Health Month, and Carolee McGrath spoke with registered nurse Angela Smith, a volunteer with the American Heart and Stroke Association. They talked about the Go Red for Women campaign to help raise awareness that heart disease is the #1 killer of women in America today.
So Go Red for Women is a way to acknowledge that heart disease is the #1 killer for women. So February is Heart Month, and what we're trying to do is the Heart Association created a campaign to empower women in the month of February to go and do lots of activities and seek information and awareness.
Do you think people are surprised when you say the #1 killer of women? Like that shocks me every time I hear that stat.
I just feel like people don't acknowledge that it's 1 in 3 women die from heart disease versus 1 in 30 from cancer. So it's bigger than any other disease, heart disease for women.
And it's also, I think, one of those sneaky ones as well. I mean, certainly you could just drop,
Right,
from a heart
right.
problem.
Correct.
As I'm sure you've seen that in your experience. So you're also the manager of stroke service at Holyoke Medical Center. Tell me some of the cases that you see.
Well, we have patients that come in and typically they don't call 911, which is not something that we want to see. We want people to call 911 when they're feeling symptoms of a heart attack or a stroke, because something can happen on your way to the hospital.
Sometimes people will not recognize that they're in trouble.
Right. You have to remember that it affects your vascular system. So I equate it to, if we think of ourselves as a house, it's your plumbing. So your blood vessel will usually block. And when that happens, you end up with mid-sternal or chest pain in the middle of your chest, almost like a real heaviness, more than indigestion, real pressure. It can radiate to your arm, to your neck, to your jaw. You can have numbness. You can also, with women, it can go to your abdomen, and you can get very weak, fatigued, diaphoretic, which sweating, and nausea and vomiting. So it can almost mask other things, but it's really something that you need to pay attention to if that happens to you.
But some people might think they have a stomach bug with those last few symptoms that you just talked about.
And that happens with both stroke and heart disease, but you have to look at your risk factors as you age, 50 and older for women, and heredity. Those are 2 things you can't control if they're in your family and you're getting older. Please recognize that these symptoms may not be something you should minimize.
Let's say you have a healthy woman in her mid to late 30s. She's a runner. Do you go to the doctor and make sure that you're all set, or?
Yeah, you still should see your doctor annually, because if you're doing all the right things, it just reaffirms that you're living the lifestyle that you should. And if you're not, then it can help you with certain things like weight loss, or if you're smoking, or any of those other cholesterol levels that just might be higher than they should be, precursor to diabetes. Every year you should check in with your doctor, and certainly when you hit 50, you really need to pay attention of those sedentary lifestyle.
I always thought that heart disease was something that men had to deal with. Is that still a common belief?
More women die from heart disease than men.
Which is amazing, but is that a common belief though? I feel like
I
feel like there's a lot of women who are like, no way, this can't be.
Just don't hear about it.
Yeah.
I just don't think. I think when you hear the survivor stories of a heart attack, often it is the men you hear about. That's what's so great about the Go Red luncheon. There'll be survivor stories. There'll be women talking about it. If you go on the internet, you can look up women survivor stories from women in their 20s, 30s, 40s to 60s. That's very inspiring to listen to some of those stories.
And tell us a little bit about the luncheon coming up.
So the luncheon is at the Log Cabin on the 24th, and it's again a way for the community to be aware of heart disease, and women, and men as well as women attend the event. There are vendors, there's stories, there's lectures, there's information, there's silent auction. It's just a really great event to bring awareness.
Angela Smith, thank you so much for joining us. I have to add that you have been a volunteer for the American Heart Association doing this, so thank you so much for your service as well.
All right, thank you.